Good morning to all. I am going to present outcome of bent ab intraneedle goniotomy versus conservative treatment for controlling intraocular pressure in primary open-angle glaucoma patients. Introduction. Early intervention is necessary in visually debilitating diseases like glaucoma. Newer treatments like MIGS use smaller incisions with less tissue manipulation. MIGS treatment saves conjunctiva, reduces complications like bleb infection and hypotony. Bent ab intraneedle goniotomy is cost-effective, quick, and allows rapid recovery. Minimal literature exists on newer modalities, so this study explores the efficacy of standalone band in reducing intraocular pressure, decreasing anti-glaucoma medication usage, studying the complications and patient quality of life over time. The goal is to provide the valuable insights for further treatments. Methods. The study was conducted at the institute over 1 year, 4 months. It was a prospective randomized controlled comparative analytical study where 46 patients with mild moderate glaucoma were included. The patients were diagnosed clinically, structurally and functionally and divided into two groups. Group A underwent surgery, whereas Group B was conservative treatment with anti-glaucoma medications. The statistical analysis included descriptive statistics and test for associations and comparisons between the groups. The p-value less than 0.05 was considered significant. Results. A standalone bank study shows that mean IOP at 3 months decreased from 15.22 at baseline to 13.48 with the error of 2.78 mm of mercury on 0.26 plus or minus 0.55 topical anti-glaucoma medications at 3 months. The percentage reduction was 11.2%, though the percentage reduction was 11.2, but all the patients had IOP less than 21 mm of mercury. Thus, our study was successful in reducing both IOP and number of AGMs significantly with improvement in quality of life in surgical group compared to medical group, proving bank to be efficacious in controlling IOP in mild to moderate glaucoma. Discussion. Intraocular pressure, Group A, where 23 patients underwent surgery. On post-operative day 1, the IOP decreased to mean of 12.52 of anti-glaucoma medications. On 1 month, the mean IOP was 15.74, however, which was slightly higher than baseline. On 3 months, the mean IOP was 13.48 with mean AGM 0.26. The patients were on, 4 patients were on 1 AGMs, whereas 1 patient was on 2 AGMs. Thus, there was significant reduction of IOP. Group B, there was no significant change in IOP at final follow-up. Intra-group comparisons, the two groups varied in terms of IOP on post-operative day 1 and 1 week. Thus, 18 patients had complete success and 5 patients had qualified success and no failure was noticed. Medication dependency. In Group A, the mean number of AGMs decreased from a maximum of 2.74 at the baseline to a minimum of 0.26 at the final follow-up. This change was statistically significant in reducing the side effects of AGM. Thus, in helping in reducing the number of AGMs in Group A was beneficial to patients in long-term basis. In Group B, the mean number of AGM increased from a minimum of 2.22 at the baseline to a maximum of 2.91 at the follow-up. This change was also statistically significant. Quality of life, it was assessed through NEI VFQ 25 questionnaire at the baseline and the final follow-up. In Group A, the mean visual questionnaire score decreased from a maximum of 92.83 at the baseline to minimum of 16.74. The quality of life improved and all patients were satisfied with the surgery. In Group B, the mean questionnaire increased from minimum of 83.58 at baseline to a maximum of 98.26 at the final follow-up, proving the patients were not satisfied with the AGM due to its side effects, and this change was also statistically significant. Intergroup, the quality of life was best in Group A than in Group B. Complications in Group A, raised IOP, 3 patients noticed raised IOP at 1 month, which was attributed to inflammation within the trabecular meshwork, and they were steroid responsive. However, the IOP was less than 21 mm mercury at 3 months, and the inflammation subsided with the usage of steroids was also tapered and stopped. IFEMA was seen in 10 patients and which was transient in nature and subsided within a week through head-end elevation, post-operatively and usage of topical steroids. Inflammation, AC reaction in the form of AC cells ranging from 0.5 to 1 plus was seen initially in 5 patients and reduced to 0, which was managed with topical steroids. Iris atrophy was seen in 1 patient. Overall, the number of complications decreased from maximum of 0.87 at POD1 to minimum of 0.17 at 3 months.
Your time is up, Dr. Meghna. Can you just go to the last slide and just give us the conclusion?
Thus, to conclude, BANG is a promising option for mix for mild to moderate glaucoma, and it reduces the reliance on anti-glaucoma medications and complications, thus preserving the conjunctiva for further traditional procedures like trabeculectomy if necessary. Thank you.
Thank you. Judges, do we ask questions or do we move ahead?
Any questions?
How did you differentiate between steroid response and IOP spike? Because IOP spike is noted after these surgeries sometimes.
Ma'am, we had taken the baseline IOP and we had seen, but that was a confounding factor.
Thank you.
No, you have chosen only moderate and severe glaucomas and
No, sir, only mild and moderate glaucoma.
mild and moderate glaucomas, all open angle.
Yes, sir.
And in open angle, you did a bang.
Yes, sir.
What was the rationale?
Sir, we had
If it is a closed angle, you do the bang, it's okay.
Sir, we wanted to try an open angle also because bang was less, it was safer and it was cost effective. So we proved that even in primary open angle, bang is efficacious. And all the studies were on closed angle. There was no study comparing with open angle. So we wanted to try bang in open angle as well as.
How do you explain that the pressure has reduced because you did in the open angle, bang in the open angle? How do you explain? How do you explain then that the pressure has reduced even in open angle glaucoma if you do a bang?
I'll go.
Okay, thank you.